Hi. Well, today we're gonna be doing an Endocoat. So I'm gonna let my dad in so he can kind of help explain. Okay, Dad, you're on.
All right. This is so the only thing that's a little bit different about this case here is that the cataract's a really bad one. What I want you to do is look into the microscope, like
Where is that?
yeah. Well, it's like about 10 inches in front of your eye.
Oh,
Yeah, there it
is
is.
that really
There's,
dark?
yeah, there's a really bright light in there. Can you see that?
Yep.
Okay. We'll get a little more medicine in the eye, and if that stings a little bit right at this point, it's totally normal. Great. Thank you. So Eli, this is the Endocoat. Don't really see anything different. So it doesn't really add anything interesting to the case. It's just a little bit thicker than the gel that we normally use, but it should look the same to you on the screen. The reason we're doing it though is because the cataract is particularly dense, and having that thicker gel really protects the eye.
What got to be so dense?
It just happens. So keep looking into that microscope and see if you can find that same light. It's a little to the right of the other two. Yeah, that's perfect right there. Try to keep the eye steady just like that. We'll get along just fine. So we're doing the capsulorhexis now, right, Eli?
Okay.
Yeah.
Capsulorhexis.
Exactly, capsulorhexis.
The capsulorhexis is where we make we puncture the capsule. Capsule. I don't have all this.
And so this is the hydrodissection. See, this cannula has like a little L shape on the end of it, and it shoots out sideways. Okay. So when we do this, it goes under the capsule,
There's like a little
between
wave.
the capsule and the cataract, and I've turned it so it's pointing down. And then when the water jets
Wow.
out, it goes behind the lens. See that? All right. Thanks. Sleeves on perfectly, Zulma. Thank you. It's like you've done this before.
So, are we on to the phaco handpiece?
Yeah, we are. This is the phaco handpiece. So we're sculpting the groove.
We're gonna divide the cataract into 4 different pieces.
Mm-hmm. We are. Maybe more.
Maybe more.
Yeah.
Okay.
This is
Well,
a
most
really
times
bad
it'll
one,
be
right?
4.
So if we just do it in 4, each piece would still be really large. So sometimes I'll go 6 or 8, you know, whatever it takes, really. It's more just like you break a piece off and suck it out.
And once the pieces are small enough, the phaco handpiece can remove the pieces of the cataract. And all that will be left after that would be to clean up the residue and insert the lens. I just realized I probably look really professional. I'm like pressing the earpiece in, but it's just because it's falling out of my ear. I'm not actually hearing anything. It's just how I hear my dad. Okay.
All right, so we got this thing about half licked.
Yeah.
So Eli, look, in this case, we have a little bit of that cortex still stuck in the bag. We're going to get that later. But for now, I'm going to fill the bag with viscoelastic. We'll get the lens in there, and then we'll remove all this material later.
Yeah.
Right?
We're inserting the lens?
Yeah, see, this is a lens that has 3 pieces. Has a body and 2 little arms, right? Whereas most of the other ones you've seen today are single piece. This is a 3-piece. They do different things.
Okay, so we're polishing lens, making sure it stays in place.
Oh, let me do a little more IA. There's still quite a bit of Endocoat in there. Did you put the IA away yet? Yeah, hook it back up, please. Thank you.
By the way, if you're wondering why I keep looking up here, it's because there's a TV up there that shows me the surgery. Okay, you look pretty close to finishing. Checking up all the viscoelastic now, right?
Right, and this Endocoat is a lot stickier than the stuff I usually use, so it takes a little more time to remove it fully.
Yeah. Expect that.
All right. We call this hydrating the incisions. It's like injecting the saline into the walls of the incision will swell it so that it seals without stitches. So you can see they're perfectly watertight even if I push on the eye.
Yeah, it's good. Now nothing will leak out.
Here's the antibiotic.
Looks like we're just putting in the... Yeah, and then we're all done.
Perfect.
Huh?
Great patient.
Yeah, if you're watching this on YouTube, make sure to like and subscribe because it helps out the channel a lot. And we make more videos.
You did it.
Really often, so
Enjoy the
thanks for
results.
watching. Bye.
I didn't give too much back.